here to talk a little bit about some concerning developments that we've seen with the vaccination rollout. And folks will know that even today, people are still concerned about getting the vaccine, particularly folks in more vulnerable groups. So we know that seniors, vulnerable seniors, some frontline staff are still waiting to be vaccinated. And we also know that, that we have lots of family members across our province who are worried about their loved ones, who are living with, anxiety and worry about when their loved one may be able to actually get the vaccine. And so in the context of all of this, we've heard some pretty disturbing stories about people who are queue jumping, folks who are deciding that that it's up to them to decide that they get to have a vaccine before anybody else in these vulnerable groups. And I mean, I just think that that's wrong. And I think that there's something that can be done about it. But to have people in Ontario who are playing by the rules, who are behaving the way that most of us would behave, which is to be respectful of the process and wait our turn. And I think most Ontarians would agree that it's the most vulnerable that need to be first in line for the vaccines. To see folks who are, flouting all of that and trying to jump in ahead is pretty troubling. So some of the examples include family members and others literally showing up at facilities that that they know vaccines are being distributed at, and they don't belong there. Those folks don't belong there. We've heard allegations of long-term care homes, and these stories are hard to take from. It's been sloppy. Doug Ford simply didn't want to invest putting together a solid vaccination plan for the province of Ontario, and that's why we see this kind of situation occurring. But it didn't have to be this way, and we want Doug Ford to fix it. I mean, there are things that can be done to fix this situation. For example, we think we should be mandating exactly who it is that's eligible for any leftover vaccines. I mean, that should be, very crystal clear. We think we should be requiring teams of vaccinators, so vaccination teams, to have an actual plan for the eventuality that they may have leftover doses at the end of a vaccination blitz. We think that there needs to be, when these kinds of situations occur, when these allegations are made, there need to be investigations. I mean, the province needs to investigate when people are queue jumping or inappropriately removing vaccines, and there has to be consequences to this kind of behavior. So this is something the government needs to do. And finally, I mean, I think the government really needs to consider some of the advice that came out of the science table, which recommended that the batches of doses be reduced to basically divide up those batches into smaller quantities to reduce the number of leftover vaccines at the end of a vaccination stint. And so, it doesn't take a lot to actually step up and do the right thing. Doug Ford, unfortunately, keeps making the same mistakes over and over again. But we think if he does these things, it could actually address the problem that we're seeing with the queue jumping in the province, and give people hope that the vaccines are actually going to, go to the people that need them the most first, and that these scofflaws and selfish, people are going to be put in their place. We all need to be in this together, and I think Doug Ford needs to make it clear what the expectations are, and people need to know that there's a fair and appropriate process for not only making sure the right people get the right doses at the right time, but that there are consequences for those who try to butt in line and take a dose when it's not their turn. So on that note, I wanted to ask Sara to say a couple of words, and then we'll take any questions folks might have. Thank you.
Thank you so much, Leader. And I think, as you've outlined, it's becoming increasingly clear that this problem is more than just one or two isolated incidents here in the province. And we really do need to nip this in the bud before it continues to get worse. And that's exactly why I've written to General Hilliard to investigate. I think for the vast majority of Ontarians, they are doing everything that they can to ensure that those vaccines, get in the arms of the most vulnerable people. But the queue jumping so far is frustrating for people, and rightfully so, as many are patiently waiting their turn in long-term care homes and in our communities to get their vaccine. That's exactly why we're calling for a clear plan with clear rules, investigations, and consequences in the worst cases of these fraudulent queue jumping scenarios. Stealing a vaccine dose from a vulnerable person or a frontline worker is not something that we should be taking lightly. And a public investigation with clear provincial directives on what should be happening with those vaccines is exactly what we need to be doing right now. So thank you for this call, and I think we're happy to take any questions from the media.
As a reminder to journalists joining us on the line this morning, if you do have a question, please use the raise your hand function to let us know, and we'll let you know when you can go ahead. First question comes from Laura Stone from the Globe and Mail. Laura, please.
Hi, Laura.
Hi there. Thanks for taking my question. I'm looking into the vaccine rollout in terms of who's next. We were hearing about long-term care facilities getting at least their first dose now. Do you think the province has presented a clear plan as to who should be in the line to get it next, and who do you think those people should be?
Well, first of all, I'm hearing some disturbing suggestions that, in fact, there are still seniors in long-term care and other settings that might not have received their vaccine yet. And if that, in fact, is the case, it's extremely problematic because it should have long been the case that those have been done. And it took our government, it took Doug Ford's government a lot longer than many other jurisdictions to actually achieve as much as they have, which is apparently not quite 100% yet. And so that's really problematic. But from day one, the vaccine rollout, plan has been, pretty loosey-goosey. We were asking for some time now for some clear targets, some clear benchmarks, some clear, places by which we can measure the effectiveness of the vaccine rollout. And of course, the government provided some broad frameworky kind of pieces, but not anything that's really detailed. And that, I think, the more detailed we can be, the better off we are in terms of people understanding, where they are in the rollout process, but also why they are where they are. And I think all of these things remain a bit murky, and I think that's problematic.
Do you think that that it should be done by age, as we've seen in Israel, for instance? That when we look at the government's phase 2 categories, there's essential workers, there's teachers, there's some professions like construction workers, and there's also increments by age. Who do you think should be the absolute next group to get this vaccine?
Well, I think the most vulnerable folks are the ones that should be getting the vaccine. I think that's pretty clear. And so some of those folks are vulnerable, because of their age. Some of those folks are vulnerable because of their living circumstances. We know that there are lots of congregate settings that still have very vulnerable people living in them, and I don't see that in the in the list. But the list is pretty broad, and so trying to get a sense of, even amongst all of those folks, who the government's going to target initially is something of concern. But I think everybody would agree that the most vulnerable people are the ones that should be getting the vaccine first, because that's who's likely to have the worst outcomes if they happen to contract COVID-19.
Next question comes from Elizabeth Payne from the Ottawa Citizen. Elizabeth, please go ahead.
Hi, thanks for taking my question. This case this week in Ottawa, the rules were pretty clear here, laid out and written down clearly by Ottawa Public Health about who should get any excess vaccine, and yet in this case, it didn't happen. So what would you have changed in order to do that? I mean, perhaps one reason whistleblowers are coming forward, or did in this case, is because it was so clear to them that this person shouldn't be on the list. What would change that could stop these cases if that's already happening, the list?
No, I appreciate that. Thanks for the question. And so, I mean, we've called for a number of things. And so, it's important that public health be very clear about the expectations. But I guess the challenge is where are the consequences? So, if people have done this or are accused of doing this, there needs to be an investigation into those allegations. There needs to be consequences so that people who might be thinking of doing this, of behaving this way, get the message that there are going to be consequences to that selfish behavior. I mean, the other thing is, there may be ways to prevent, for example, excess vaccines from being hanging around, if you will, and creating uncertainty around what can be done with them or who should be getting them. And so I think that the kind of rules around that are important, but also preventing the scenario where there are the scenarios that are going to lead to those excess vaccines being around is another thing that can be done. And so that's why I mentioned the science table recommendation around further dividing the batches to make them smaller batches to reduce the likelihood of significant vaccines being left over at the end of a vaccination bout. And so, I mean, again, I think that human beings will behave in certain ways that the rest of us will say are not appropriate. I just think about cabinet ministers traveling during the Christmas break. But what we do need to do is not only make it clear, but to ensure that people know that if they do this, they will be investigated. There will be consequences, and then provide some of the other things to prevent the likelihood of these scenarios from occurring.
And just to follow up on that, what form would the investigation take? Would that be under provincial rules, under local the public health legislation? How would that flow, or have you thought through that part?
Yeah, I mean, there's a couple of things. I mean, so where there's allegations of criminal behavior, then we have a system for that, obviously already. But if that is not the case, and there doesn't appear to be any criminal behavior, then we need to make clear exactly what the process is and exactly what the ramifications are. And I think because these things are lacking, because I think the government really didn't think ahead in terms of this likelihood, then they need to get their heads around how do we put in place some kind of accountability system around folks that are going to flout the rules and try to butt in line, jump the queue for vaccinations.
Okay, thanks very much.
Thanks, Elizabeth.
Next question comes from Susan Gamble from the Brantford Expositor. Susan, please go ahead.
Hi there.
Hi.
I'm kind of looking into the situation still in Brantford. And at this home, of course, as you know, some people have admitted, the owner and his wife admitted that they signed up for the vaccine in Brantford, even though I think they live in Toronto. The Retirement Home Regulatory Authority is the one investigating this, which seems odd. I don't believe they have the power to charge or to do anything under it. They seem to be gathering information and say they'll pass it on. Would you be suggesting that agency is the right place to turn something like this toward, or should it be under bylaws or some other thing? It seems like the folks in BC got hammered with immediate consequences when they clearly jumped the queue. So why is the Retirement Home Regulatory Authority looking into things here in Brantford?
Well, I mean, that's a really great question, and I guess my first reaction is that authority hasn't performed well over the years, irregardless of COVID-19. I mean, they have not done a good job in regulating the retirement home sector, and to rely on them for something like this seems to me to be a pretty weak-kneed response. by the government. And so it does lead to the question, though, is there a vacuum in terms of public policy in this regard? It appears to be the case. And so let's be clear about what the expectations are. And we're heading back to the legislature next week. If the government doesn't have, which it doesn't appear that they do, an appropriate response to these kinds of situations, then we should be putting one in place and doing so very quickly, before we're in a situation where the vaccine rollout is ramping up.
And if I can just follow that up, do you think this whole issue would be even concerning us if the vaccine was flowing freely and quickly at this point?
Well, I mean, it's hard to kind of project on a hypothetical, but what I can say is, to see how slowly the government has rolled out the vaccines that they received already is really problematic. And so, I find it absolutely shocking that the rollout was as bad as it was, and that the most vulnerable seniors had to wait in long-term care, had to wait as long as they did to actually receive the vaccines. And so, when I don't know that I think it's clear that the holdup on the vaccine deliveries has been a problem across the country. But I think Doug Ford, blaming their lack of urgency in terms of vaccinating seniors on the problem nationally around obtaining vaccines, it's just, it just doesn't hold water. It's just not the case. They had enough vaccines to vaccinate every single senior and frontline care worker in long-term care, and they just didn't get around to it because they didn't think it was urgent enough. And to think that there are still some folks that haven't received those vaccines in terms of seniors living in long-term care, and the government simply saying, well, as far as we're concerned, we're done. I mean, what does that say about the value of the lives of those folks who, I guess, are a rounding error for the government? Those are real people. They're really vulnerable. And it's not good enough to say we're almost there. And so that's good enough. It's really, really disturbing to see how the government doesn't seem to, value those folks whose lives are being lost. And that's pretty troubling.
Our next question comes from Nitin Chopra from Prime Asia TV. Nitin, please go ahead.
Hi, Nitin.
Hi, Andrea. Hello, Sara. My question to you is, since Ontario is the biggest province in Canada, one of the biggest provinces, and we are facing shortage of vaccine. We know that there is a dilemma that Moderna will come and there will be shortage this month also. So how you see your comments on that when yesterday Prime Minister Trudeau asked vaccine from India? So finally you see it as a positive step. Your reaction on that?
Well, thanks for the question, and I think that everything we can do to try to bring vaccines to our country in a way that's internationally acceptable and fair makes sense to me. I think that's the job of the federal government, and they need to continue to do that. So, I guess I know it's really disappointing and troubling to Ontarians and to Canadians that we've had this glitch with the receipt of our batches of vaccines from the various suppliers, and the government of Canada, Mr. Trudeau and his folks need to continue to do everything they can to ramp up the delivery of vaccines from wherever they can. So I think that's simply their job, and they need to continue to do it.
Okay, thank you for this answer. And I have a second question in terms of the auto insurance or a postal code discrimination. Ontario NDP also worked a lot and they were very vocal. We have seen Scarborough or Brampton, they see discrimination in this. Just to follow up, why can't Ontario have a same kind of a auto insurance system as British Columbia has under one umbrella, ICBC? So why can't Ontario do the same, reward the good drivers and punish the bad drivers in all the area to remove the discrimination? Where your party stand is, why this has not been discussed now? Only election time this issues comes up. After that, any party, hardly matters as Ontario NDP or PC or other parties, they just left it on the people and they're just crying for all these years? Thank you.
Thanks very much. And I'm going to ask Sara to respond as well to this. But on the contrary, I mean, we've got MPPs that are constantly raising the issue of auto insurance. In fact, I think Tom Rakocevic just recently, who's the MPP for Humber River Black Creek, sent a letter out to the government about the fact that the police are showing a 50% reduction in accidents, and yet insurance rates have not budged. And it in fact was the NDP that first raised publicly the issue of postal code discrimination, and we're the only party that continues to say that we will take on the insurance industry. The Liberals, after 15 years, didn't. Every time they made a change, it benefited the insurance industry, didn't benefit the drivers. And now we've had the same thing with Doug Ford and the Conservatives. There's a really cozy relationship between those parties and some of the those leaders, if you will, in the insurance industry. We think that the most important thing that can happen in Ontario is that we have a system of auto insurance that's, that doesn't build in discrimination, that is fair, that shows that that the premiums are actually related to a person's record of in terms of accidents and driving, and where the rates are reflective of the number of per capita accidents, because we know that's not the case. We have very few number of accidents per capita, and yet we have the highest insurance rates. And as you've described accurately, those insurance rates are even higher in some neighborhoods based on postal code. So Sara, I don't know if there's something that you wanted to add, but certainly, Brampton, a lot of the areas that you represent, as well as Scarborough, are two particular places where there's a problem with our auto insurance and the inequities that are built in.
Thank you, Leader. Absolutely. And I think, to just reiterate, New Democrats, we have on several occasions asked this government, especially during the pandemic, to even consider a 50% reduction on people's auto insurance rates, because we understand what an impact this has to people's bottom line at the end of the month, especially in communities like Brampton or Scarborough, where many of us are not even driving throughout the pandemic. We've seen other provinces that have been able to implement policies that have helped cap those rates for drivers, and those savings that the auto insurance companies are accruing is going back to those good drivers. That's not happening here in the province of Ontario. We actually saw the minister leave it up to these auto insurance companies, the big conglomerates, to decide what those reductions were going to look like, and there wasn't something that was mandated across the board. So it's something that we're going to continue fighting for. I know we just recently appointed a new critic for auto insurance, Kevin Yard, here in Brampton. So certainly when we're back in the legislature, this is something we're going to continue fighting for. But we have a clear track record on advocating for lower auto insurance rates, ending postal code discrimination. And that doesn't just come from one MPP, that's an entire party stand.
Your next question comes from Sneh Dougal with Queen's Park Briefing. Sneh, please go ahead.
Morning, Sneh.
Hi, good morning. Thanks for taking our questions. Just wanted to ask you, first off, you've mentioned about consequences for queue jumping. Could you elaborate a bit on that and what you think would be acceptable in instances where this is found? Are we talking fines? Are we talking people not receiving their second doses? What do you think would be appropriate?
Well, I mean, I certainly don't believe that the withholding of a second dose is in the interest of public health. I mean, I would have to get some advice on that, but my gut would say that doesn't sound like an appropriate response. But certainly anything from fines, from a publication of names, so that there's a deterrent and your name doesn't get out there as a queue jumper. I think there's all kinds of things that we can look at, both as a as a kind of a consequence and also as a deterrent. But I mean, unfortunately, it doesn't appear that the government's stepping up and doing any of that, and that's why we're recommending that they do so. And as I said earlier, if there's criminal behavior like fraud that can be part of that mix, then I think that's appropriate as well.
Thank you. And just on a bit of a different note, with the legislature resuming next week, just wanted to get your thoughts and just want to hear from you kind of what the NDP's priorities are going to be for this next sitting.
So you're jumping ahead to tomorrow's press conference, Nay. But look, I mean, we've been pretty clear that we're extremely unhappy with this government's COVID-19 response writ large. So we're going to continue to focus on the things that matter to everyday families, and that's what's happened to their loved ones in long-term care. Where's the accountability around that? I mean, we have a government that is about to shut down, or has decided to shut down, the commission that they put in place to examine the response to COVID-19 while we're still in the midst of it. The government, we're hearing troubling predictions about yet another wave of COVID-19 coming in April. And I mean, look, there's still things that we can do to give people hope that it doesn't become the same scenario that we faced over and over again. So we're going to continue to push the government on things like, paid sick days for workers, a solution that everybody believes is the right thing to do, except Doug Ford and Monty McNaughton. We want to make sure that the government's, doing what they should be doing around reducing class sizes, for example. We know that there are, significant amounts, tens of thousands, if not more, of rapid tests that are sitting on a shelf. And so that asymptomatic and widespread testing in workplaces and in schools to help, to help catch especially the variants of concern, before they catch hold in community. I mean, there's all kinds of things that the government could and should be doing to, to protect us from another wave, but they're not. And so we're going to be reminding them of what those things are. So it's both propositional. We've got a number of bills in the legislature and motions that we are going to ask the government to agree to, including things like 4 hours of hands-on care. So we're going to go in with an agenda that says, here are some things that the government needs to do, and they need to do them right away. And hopefully we'll see some movement from Doug Ford on some of these really key issues.
As a final reminder to journalists joining us this morning, if you do have a question, please use the raise your hand function to let us know, and we will let you know when you can go ahead. There are no further questions at this time.
Thanks, everybody. I hope you all have a great day. And thank you, Sarah, for joining me this morning. Appreciate it.
Thank you, everyone.